It is American Heart Month, and doctors are seeing one particular cardiac condition surging during the pandemic.
Cases of broken heart syndrome in women have increased tenfold. Dr. George Adesina is a cardiologist with Kelsey-Seybold Clinic and joins us live to talk more about it. Good morning to you. Now, we know that heart disease is the #1 killer of women, and this is a component of it. Who's at risk of broken heart syndrome, and then what do those symptoms look like?
So this syndrome disproportionately affects our middle-aged and older women, and especially those who have an underlying history of anxiety or depression are usually at a higher risk. The symptoms can include palpitations, shortness of breath, and chest pain. And that chest pain can actually be severe enough to mimic the signs and symptoms of someone having a heart attack.
Wow. Okay, doctor, how is something like this treated? How would somebody identify that they are having this, and then how would it be treated?
So luckily, with medications that we can give to slow the heart rate down, to help with blood pressure, luckily this can be not only treatable but reversible. So most patients actually regain 100% normal function of their heart after this event.
Well, we know that people have been through a lot, just an emotional roller coaster during the pandemic. Why has it become more prevalent during this time? Is it because it's just been such a stressful time, or people losing a lot of people and there's literally suffering heartbreak? What's going on here?
Honestly, the jury's still out. We're not exactly sure why we're seeing this kind of huge spike, but I personally believe just the underlying stress that we're all having collectively is definitely playing a major contributing factor. We've been in isolation, we've lost loved ones, so I think all of those things are most likely contributing to this for sure.
Oh, well, what are some important steps that people can take for their heart health, specifically women, as it relates to this issue we're talking about?
I think most importantly is knowing those warning signs, and like anything in cardiology, time is of the essence. So prompt diagnosis, prompt treatment increases the chances of you having a favorable clinical outcome.
And prevention of any type of heart problem is certainly the ideal situation, and we can build our hearts and strengthen them. What are some suggestions that you think people might actually take to heart, so to speak, and really try to make some lifestyle changes to protect their ticker?
100%. So as a cardiologist, of course, we treat heart disease. We also want to prevent it. So knowing your numbers. So checking your blood pressure, your cholesterol, keeping a healthy weight, not smoking, and definitely seeing your doctor at least once a year. That gives us an idea of how well you're doing and what we can do to prevent you from developing heart disease.
And doctor, if you don't get some of the symptoms under control, like the ones we've been showing on the screen, symptoms of the broken heart syndrome, what could that eventually lead to?
So if it's not treated and it's not well controlled, complications can include congestive heart failure. It can include arrhythmias, and unfortunately, in fatal cases, it can be fatal and cause death. Luckily, the death rate from broken heart syndrome is fairly rare, but it can happen. So it's really important to, again, know this warning signs and symptoms, get proper diagnosis, and also get treated.
Dr. Adesina, what important facts to give our viewers today. Thanks for taking time from Kelsey-Seybold Clinic to walk us through this.
Thank you, and that's so great to be with you both.